the arc on. So the next portion of the procedure is to keep this instrument sterile and to get the ring. And so this is the portion I talked about as far as the numbers, and we'll adjust that ring number in just a second. If you notice, there's a notch here and a notch here which we'll have to line up. And what we do first is place the right side on. So this left side again needs to be away because we would be bumping it if we didn't have that option. So we want to swing that all the way out on the left. And then we want to line up the right side first, lining up this ring into that notch. Okay? If you have an assistant, they can hold that. The next thing you need to do is adjust the ring on the left side. And you can see there's a notch here that's a little difficult to see, but what we'll need to do is loosen this so that the ring will move. And then spin this around so that the notches are lined up to the tabs there. Once that's lined up, you can lock this in if you're by yourself, and that'll help hold it. But the main thing you need to check is that this is pushed all the way medially, and then there's a screw on the bottom here that you need to tighten to lock that in. And I'll show that to you here by adjusting that. This screw here needs to be tight. And now the arc is securely attached to the patient, and even though I'm loose on the ring, as long as I don't drop this and let it get contaminated, we're safe to use it as needed. The next portion of our procedure is going to be, besides lining up the numbers, getting ready to drill our hole with whether it's a burr hole craniotomy or using the reduction tubes to do a twist drill component. So the patient is all draped, everything's sterile. We have a portion of the skull that we're going to go through, and that area is ideally prepped and clear. And so what we can do are the following. If we need to test our target point, and let's say we did 90, 90, 90, obviously we don't want a straight 90 here normally because we'll go through a superior sagittal sinus, but for this demonstration we can today. So we can, if all our coordinates are appropriate, and we can go to a 90 arc, and again the arc is an arc versus the ring is a total ring here if you forget which one is which. What we can do now is check our targeting. So we use our 2 reduction tubes here. Kind of slide in. And then we can use our small, or we can use 1 reduction tube. We can use our small drill, and that will tell us where we are in space. And then a skin incision, if it's just a small stereotactic biopsy, can be made. Or if we need to do a large burr hole craniotomy, we want to give this all back to the scrub nurse to make sure that it doesn't get contaminated as we're moving things around. And this ring can be moved up out of the way temporarily, and a burr hole can be made. Now the last thing I didn't talk about, even though I moved the arc coordinate, is the ring. And the reason I saved it for last is there's something very important to notice here. If you again notice on all the other marks that we've gone through, these are 1 millimeter ticks and 1 degree ticks markings that are on each of the reference frame components of the arc, except for this one here. As you notice, you go from 30, 60 to 90. And in between those, there's a longer line. So this line here would be 70, this line here would be 80, and then this is marked out as 90. You only have 2 degree difference markers here. So if you needed 61, you'd have to split the difference there. Obviously, if you needed an even number 62, that'd be fine. But if you needed 61 or 63, you'd have to go in between and lock that in. Now, there's only a marker on one side of the ring, so it's very important you check that. And this black line obviously will tell you kind of where you're at. But the one good thing is, in space, right now, the top of this black reduction component is 190 degrees off. Okay? So if we're doing a biopsy, per se, and let's say we just move this to 90, just like all our other components are moved to 90 here, we go back and we put our large reduction tube in, and we're trying to measure how far we should have our safety nut catch device here down in. Well, the way we can do that is take our ruler and measure 190, which we can't get to, but we could measure on our biopsy needle 190 here, and then add the offset of whatever device we're using. And in this case it's 10 for this component, and it pretty much standard will be another 2 to add, make it 12. As you can see there, that's about 12 millimeters offset. And then any type of stereotactic biopsy will get you to 202 on the ruler, because you add the 190 from the black line, excuse me while the head's moving, and then another 12, which will get you to 202. And that's a pretty common number that we remember. Okay, so as I take these reduction tubes out, just to re-review, placing this on one more time as I take it off. It's very important that we set the vertical position on first before we even attempt to put these rings on the side rails of the Lexel coordinate frame. When placing each side on, again, it's good to have two individuals involved, one to be sterile, holding a sterile screwdriver, and to help slide it onto the rail, and then another individual who doesn't have a sterile screwdriver holding it, and that helps slide this on correctly if it's not wiggling correct, just to help it wiggle and to get it down. And then both individuals can check each other, and then being very careful and very detail oriented about getting the measurement to the level, to the appropriate AP diameter, and that's our AP coordinate. Our lateral coordinate has already been determined beforehand by locking these components. This screw here controls that one, and then our left side is going to be controlled by this metal piece and locking that in. And then again, remembering that this device here with this screw on the back can be slid in and out, and it'll want to be slid out. Then having the patient draped, and then cutting holes for the drape, placing this on with the right side first, ideally with an assistant, okay, and this needs to be slightly loose to give you some play, and then lining up this notch by sliding this left lateral component in to the ring and lining those notches up. Then after that is fixated appropriately, pushing this, making sure this is pushed in, and then tightening that. Obviously if you have an assistant it'll be a little easier. Tightening that so now you're secure. And then setting your ring and your arc to the appropriate numbers. Double checking that your offset is 0 here, and then confirming your target location as far as your skin incision if needed. And then if burr holes to be done, you can swing this out of the way and reset your ring value and get all the work you need to do as far as your craniotomy, and then bring that ring down. Okay, I hope that is helpful. Moving on, we'll talk about disassembling if on the next video. Thank you.